If you're over 65 and dealing with chronic back pain, leg pain, or stiffness that keeps getting worse throughout the day, you've probably been told the same thing over and over. That's just aging. But here's the truth. Most spine pain after 65 isn't caused by muscle weakness or poor conditioning. It's caused by degenerative changes that no one ever explains or treats correctly. I've spent over 35 years helping thousands of older adults avoid surgery and regain walking, standing, and independence by addressing the real mechanical causes behind conditions like disc injuries, arthritis, stenosis, and sciatica. In this video, I'll break down the most common spinal changes after age 65, show you how they directly affect your daily life, and walk you through a unique, non-surgical, step-by-step approach I developed called the Neurospinal Restoration Program, which has a 90% plus success rate in treating chronic spinal degenerative conditions. By the end of this video, you'll understand what's actually happening in your spine and why decline with age is not inevitable. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs, without surgery. I upload a new video every week. If you're over 65 and your back or leg pain keeps coming back, the most common explanation you hear is this: it's normal aging. Your spine is wearing out, and once that idea takes hold, it's easy to believe that worsening pain, stiffness, or loss of independence is something you just have to accept or learn to live with. But age alone does not damage the spine. Time does, but more specifically, time spent under uncorrected mechanical stress. I'm about to dive in deep into this, so keep watching. Let's define what doctors call degeneration. Degeneration does not mean your spine's breaking down because you're getting older. Degeneration simply means that tissues have been exposed to repeated pressure, strain, or distortion long enough for structural changes to occur. Those changes could happen at 40, 55, or even 75. Yes, some spinal changes are more common after 65, but common does not mean caused by age. When changes are more advanced, it usually means that there's been an underlying issue affecting how the spine was moving or bearing load for years, sometimes decades. The longer that issue went undetected, the more stress accumulated, and the more the body adapted around it. This is why two people in the same age can have completely different spines. One may have mild degenerative changes, and the other may have more advanced degenerative changes. One may walk miles without pain, while the other struggles to stand for 10 minutes. Age didn't create that difference. History did, specifically your history. Your movement patterns, posture, injuries, repetitive stress, and how pressure was managed over time all matter far more than simply your age. When mechanical distortions in the spine are not corrected, the body doesn't fail, it compensates. It stiffens certain areas, it limits motion, it changes how forces are distributed. Those adaptations may protect you short term, but degenerative changes build up over time. Now that you understand that age itself is not the cause, let's talk about the specific spine changes many people over 65 are told they have and translate those medical terms into plain language that actually makes sense. We'll start with the discs because this is where many problems begin. Spinal discs sit between the bones of your spine and they act like cushions and spacers. A disc bulge means the disc has changed shape and it's pushing outward, usually because it's been under repeated pressure over time. The outer wall is still intact. A disc herniation means that pressure has pushed part of the inner material farther out, creating more irritation in nearby nerves. This is not caused by age. They develop when abnormal loads on the disc continue long enough without correction, most commonly at the L4, L5 level. Next is degenerative disc disease, which is one of the most misunderstood diagnoses. This does not mean a disease in the traditional sense. It simply describes discs that have lost height or hydration over time due to prolonged compression. When discs lose height, the space between the bones decreases, which can increase joint stress and reduce room for nerves. Again, this is a time issue, not an age-triggered event. Arthritis in the spine refers to changes in the small joints at the back of the spine. These joints respond to excess motion or uneven loading by thickening and developing bony spurs. These bony changes is really the body's attempt to stabilize an area that's been under strain. The result is often limited mobility, morning stiffness, and pain with standing or walking. Now let's talk about stenosis, a term that simply means narrowing. Lumbar spinal stenosis refers to narrowing in the central canal where the nerves travel. Foraminal stenosis refers to narrowing in the side openings where the nerves exit the spine. These changes don't happen overnight. They develop as discs lose height, joints enlarge, and surrounding tissues adapt to long-term stress. The nerves become crowded, which is why symptoms often show up in the legs, especially with standing and walking. What's important to understand is that these conditions rarely exist in isolation. A disc change affects joint loading, joint changes affect nerve space, nerve irritation affects how confidently you move. That's why people are often given multiple diagnoses and still don't feel that they have a clear explanation. This is also why symptoms tend to follow patterns instead of being constant. You may feel fine early in the day and struggle later. You may tolerate sitting better than standing. You may notice leg pain before back pain, or vice versa for all those. These patterns reflect how pressure builds and how much tolerance your spine and nerves have at that moment. Now we're going to look at why so many common treatments fail to address these patterns and what actually needs to change to relieve pain and live normally again. Another major reason people don't get lasting relief is that most care focuses on a single cause when spinal pain almost always has multiple contributors working together. By the time someone's over 65 and dealing with ongoing back or leg pain, it's rarely just a disc or just arthritis or just a nerve. Common underlying contributors include spinal misalignment, areas of instability, long-standing posture problems, an unlevel pelvis, muscle imbalances, all that have developed over time. It may even involve failed back surgery. Each of these factors changes how forces move through the spine. On their own, they may not cause much trouble, but together they compound pressure and irritation at specific levels. For example, if the pelvis is unlevel, one side of the lower spine absorbs more load. That increases disc stress at L4-5 or L5-S1. If posture is altered or movement is guarded because of pain, then certain joints will stiffen while others will overwork. Muscles tighten in protective patterns, reducing support where it's needed most. Over time, these compensations add up. The problem is that most treatments address only one piece. Physical therapy may focus on strengthening without correcting the alignment. Injections may calm nerve pain without addressing instability. Exercises may target muscles without reducing the nerve compression first. When only one factor is treated, the others continue to drive stress and symptoms return. What actually needs to change is how all of these factors interact. Alignment, stability, muscle control, posture, pressure on the nerves have to be addressed together and in the right order. Pressure on the nerve must be reduced before exercise can be introduced. Movement must be restored before strength is trained. When multiple causes are treated as one connected system, pain relief becomes permanent versus temporary. Movement patterns and stability improve, and inflammation subsides naturally without using drugs. These are some of the benefits of a multimodal treatment program, which I'll discuss next. So in a moment, I'll outline my simple step-by-step path that brings all of these elements together into a safe, non-surgical multimodal treatment program that focuses on relieving pain, healing tissues, stabilizing the spine, and restoring function. Once it becomes clear that pain isn't just an unavoidable part of aging, the next step is having a structured, non-surgical plan that addresses all of the underlying causes of pain, not just a single diagnosis. This is why I created the Neurospinal Restoration Program. The Neurospinal Restoration Program was designed to reduce disc pressure, calm nerve irritation, and restore movement tolerance in a safe, step-by-step way for all patients, including older adults. There are 7 steps in my Neurospinal Restoration Program. Step 1 is the comprehensive initial consultation and examination. This step is about finding everything that's contributing to your pain, your limitation, and your dysfunction. Not just what shows up on a single MRI. It includes hands-on evaluation, orthopedic testing, a full spine nerve scan, diagnostic digital x-rays. The goal is to understand how degeneration, alignment, instability, posture, pelvic imbalance, nerve pressure, and muscle changes are interacting together. Most people don't have one cause, they have several. This step makes sure none of them are missed. Step number 2 is non-surgical robotic laser spinal decompression. This is the core of our program and the step that makes everything else possible. It combines true non-surgical spinal decompression and class 4 robotic laser therapy at the exact same time, working together as a single synchronized system. The decompression component uses a precision computer-guided table to gently reduce pressure on spinal discs and nerves. Think about it. Pressure on the disc, pressure on the nerve. What makes more sense to take the pressure off the disc and pressure off the nerve? We're treating discs and nerves. That's what this is. This controlled movement creates negative pressure inside the disc, almost like a vacuum, helping bulging or herniated disc material move back toward the center. It also increases space between the vertebrae, immediately reducing pressure on irritated nerves, especially the ones that cause leg pain and sciatica. At the same time, Class 4 robotic laser therapy is applied directly to the injured area. The laser penetrates deep into the spine to reduce inflammation around the disc and the nerves, to increase cellular energy needed for tissue repair, and even improve blood flow so more oxygen and nutrients reach damaged tissues. The key is that these two therapies are happening simultaneously at the exact same time. As pressure is being removed from the disc, healing is being accelerated at the same moment. Muscles relax instead of resisting decompression, nerves can calm, and discs are given the best possible environment to recover. This is why results are faster, safer, and more consistent than using either treatment alone. Step number 3 is our disc replenishment and healing protocol. Decompression draws nutrients into the disc, but the body often needs supplemental nutrients to rebuild disc and cartilage tissue during injury recovery. This is especially important if you're over age 40, what a lot of people aren't told is the body can produce some of these nutrients. It actually stops doing this around age 40, give or take a year or two. This step provides targeted nutritional and supplemental support to help rebuild disc tissue, support nerve healing, reduce inflammation, calm burning nerve pain, and improve tissue resilience. These protocols are specific and tailored. They're not generic supplements. Step number 4 is neurofunctional spinal correction. So this step restores proper joint function and nerve function, not just alignment. It's not just about things looking straight or looking aligned. They actually have to function the way they were meant to function. When vertebrae lose normal movement, nerve signaling becomes disrupted. Neurofunctional chiropractic adjustments are applied carefully and precisely to fine-tune the spinal motion after pressure has already been reduced, always in directions that unload discs and nerves rather than stressing them. Step number 5 is muscle tissue restoration. So long-standing pain changes muscle tissue itself. Fibrous adhesions and scar-like restrictions form, causing abnormal pulling on bones and nerves. This step restores normal muscle fiber, its elasticity especially, so that muscles can move independently again, reducing abnormal tension and improving spinal support. Step number 6 is neuromuscular reeducation. So chronic pain will create faulty movement patterns as the body adapts and compensates over time. This step retrains the brain and nervous system to move properly again. It goes far beyond simple exercise or core strengthening, and it focuses on restoring safe, confident movement without reloading irritated discs or nerves. And number 7 is our progress reexamination and functional reassessment. The same tests performed at the beginning are repeated to objectively measure improvement. We don't just cross our fingers and hope you'll get better, we actually test it. Nerve scans, x-rays, range of motion testing, pelvic balance, orthopedic exams, and disability indexes are reviewed to ensure that real functional change is happening. The focus is not just pain relief, but better walking, better standing, better endurance, and long-term independence. The goal is to give you long-lasting results. Together, these 7 steps create a comprehensive non-surgical, non-drug path forward. By reducing pressure, accelerating healing, restoring motion, and retraining movement as one connected system, the Neurospinal Restoration Program gives people over 65, as well as those younger, a clear way to move better, feel better, and regain confidence in daily life, especially when all other forms of treatment have failed them. If you take one thing away from this video, it's that ongoing back and leg pain after 65 is not something you simply have to live with. That was the title of my book, Low Back Pain is Not a Life Sentence. When the real causes are identified and addressed together, the pain can be relieved, pressure can be reduced, and movement can improve even if you've been dealing with this for years. This is not about chasing pain relief or managing symptoms forever. It's about restoring function and protecting your independence. If you got value from this video, please like it and share it so more people can learn that pain after 65 is not inevitable. Leave your questions in the comments below. I read and reply to every single one. And remember to subscribe if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs, without surgery. Now, if you want to learn how to walk longer and more comfortably with spinal stenosis, this is the video you should watch next. Please go watch this video right now.